Good afternoon. Thanks everybody for joining us. Thank you for your hard work during what has been a very challenging and unusual time. So the fact that our institutions have continued to function and that students have been educated, and now that we've seen many of them graduate this spring, it's a remarkable period across higher education in the country and certainly across the University of Texas system. I am tremendously impressed by the effort that our faculty, our staff have made, but also students who have worked in a completely different environment. And while I wouldn't say we haven't missed a beat, and I wouldn't say the movement online has been perfect by any stretch, we had 100% of our students and faculty at our academic institutions online, and a remarkable achievement in a period of a week or two. So the UT system has continued, I believe, in its service to Texas, and it's one of the most important institutions in this state. And we will continue that throughout the summer and the fall and the years to come. So this is a time of great challenge because of the pandemic, but in addition, in Texas, the downturn in the oil market certainly had an impact on us that is unusual and will exacerbate the challenges, the fiscal challenges of the pandemic. But one of the messages that I talk to the presidents about many times a week when we talk is how we think about our role, our essential mission, and when we're making the kinds of changes that we have to make now and adjusting for the future, how do we do this in a way that we emerge more strongly than in the past? And so for me, it's helpful to think of a point some years out and how, as a set of strategies, we try to achieve the goals of the university system. And this is not just wishful thinking or platitudes. I believe that the pivot to online, 100% of all faculty and students going online, will make a huge difference in the future in how we educate Texans. We were in no position before to educate all Texans who were prepared for a college education when the population doubles. Now we're going to think about that in a completely different way. Remote work. I mean, we've struggled for a long time, not just at the university system, but employers across the country about how we manage issues of working remotely, whether employees can do it effectively, whether managers feel comfortable and can assess the work. We've learned so much in the past 2 months about that. And there's no question in my mind that in the future, the University of Texas system, but all employers will have not an insignificant fraction of the workforce working remotely. And I think that goes for us as well. And that does a lot of things. One is, for some people, it cuts out a very significant commute. For others, it allows them to use that time productively. They couldn't otherwise. If they have health or other challenges that would make it more difficult to be in the office, I think they can look forward to working remotely. And at the end of the day, we may change our real estate footprint and have opportunities for additional revenues because of the use of less space. The third thing I'd say is that the relaxation of restrictions on telemedicine, which has been, I think, a long time goal that many people in the health profession have sought, and it happened during COVID. And we saw a remarkable upsurge, hundreds of thousands of patient visits from our institutions where they could be at home, speak to a healthcare professional, and have effective treatment. It may not be a complete substitute for a face-to-face visit, but it's certainly a huge step from not having access to healthcare. So there are a lot of ways I think that what we're learning now and the challenges we're going through are going to help us in the future. There's been a lot written about whether we go back to in-person instruction in the fall. And there's been, most of the discussion's been about, on the one hand, whether or not we're adequately taking into consideration the health and safety concerns, and on the other hand, whether there's a huge budget challenge that's going to force people to make a decision that may not be in the best interests of the community. I think there's an issue that's been left out of this discussion that is at least as important as the others, and that is the underlying mission of the university, what we do and who we serve. And many of our students are not in a position to learn effectively, and it's not feasible for many of them to learn online completely. We know from the research that if people don't go immediately on to college, their chances of success are diminished. We know that people who take time out, who stop out and then come back, their opportunities are diminished. And so it's my view that first of all, we need to think about that underlying mission, why we exist, and the people that we serve, and what the costs will be if we don't adequately both protect our faculty and staff and our students and our visitors, but at the same time, offer an opportunity for students to continue to succeed. The options for them are not terrific right now. The unemployment rate for people 16 to 19 years old in the country is about 30%. So the idea that you can stop out and earn money for college or do things that you might have thought about before are not quite as attractive as they might have been at one time. So I think we've made big strides this spring, and this summer we're entirely online now. Some of our campuses are starting to open laboratories with new rules in place so that people who need to be in the lab are there, they're socially distanced, they leave when their experiments are over and do write-ups remotely. But we need to continue, as we learn how to manage this situation, to continue to make additional steps to perform the $3 billion of research that takes place annually across the system, to educate 240,000 students, and to treat hundreds of thousands of patients across the system in the most effective way possible. So it would be a simple thing. I know all of you watch the news and read the reports on the pandemic and on the progress of potential vaccines and therapeutics. There are still a lot of unknowns. If we knew the date that we might have a vaccine that could be effective and available across a large population, then we might delay opening until that time. But we have no idea what that'll be. Typically it takes years for that to happen. My money's on it happening more rapidly this time because of the global focus on it and the amount of resources and talent that's been brought to bear on it. In the University of Texas system alone, we've got, 40 or so research projects involving vaccines, and another 150 or so that relate to therapeutics at one university system. So I think there's a lot of promise there, but there's still an enormous amount of unknown, and we're operating at a time when we simply have to learn as we go, do the best we can, and work within this this new environment where we don't know everything about the disease. We don't know everything about what the treatments will look like and whether there'll be a vaccine. So this idea that I suspect you've seen, that we are planning at our academic institution, our health institutions they never really close down. The academic institutions are making plans now to start up in the fall at the normal time. And typically, or generally, I say to finish by Thanksgiving in person. There may be some differences based on location and how many residential students they have and other kinds of campus-specific elements. But generally, our approach is going to be to reopen in late August, no breaks, go to Thanksgiving, work remotely after that, and take all the precautions we can to protect faculty, staff, students, and visitors on our institutions and make them safe. And that's the activity that's going on at an incredible pace right now across 8 institutions and with the team here to make sure that we have residences that are safe, that we have health evaluations and testing capacity, that we have social distancing and masking requirements on the campus, and do everything we can to make it a safe environment and to be resilient. We had an experiment in resiliency in March, and we passed. And I believe that institutions in the future, all organizations, are going to have to continue to prioritize resiliency and flexibility. If there's an outbreak, we will obviously change the approach we're taking. If there's a vaccine or effective therapeutics that are widespread, we can make changes then as well. But there's an enormous amount of work going on. I've seen some of the work from UT Dallas has put out a reopening plan, UT San Antonio, one on their research activities, UT Austin on athletics. I thought right now I'd ask David Lakey, who's been working specifically with San Antonio on their planning. So not only at the state and system level are we doing this, but we are working individually with campuses on their planning. And David, you might say a word about some of the considerations that are taking place at San Antonio.
Absolutely, and thank you, Chancellor. We've been working very closely with UT San Antonio from actually about January when we started having students come back. And so they're in a new phase now, trying to think through how do they re-enter their campus. As the Chancellor noted, they put together what I thought was a really well-developed research plan on how to restart their research engine. One of the plans they're working on right now is athletics, and how do they protect the student athletes coming back on campus and do it in a smart way. But they've decided to, in order to make sure that they have the input that they need, they put together a task force like other universities, but they also put together a special public health advisory committee that I sit on. Don Emmerich, the director of the San Antonio Health Department, sits on, and Jason Bowling, who works for UT Health Science Center San Antonio. And so 3 public health individuals that will be hopefully helpful to them as they think through these sticky issues of masks. How can you really do testing? What's the right amount of testing to take place? The contact tracing that needs to take place, and the role of the local health department versus the university. What are the policies in the dorms? What are the policies in the laboratories in order to make sure good research takes place, and in the dorms that we house our students in a safe environment? Yeah, I think one of the other really important parts of these plans that all of them are working through is how do you protect the faculty and staff, especially the older faculty? A lot of our campuses have people, significant majority of their faculty, 20, 25% that are older than the age of 60, 65. And so how do we put in the right amount of barriers and policies to protect those individuals? They're not unique. They are sharing these policies and procedures. And again, it's approved at the very highest level of their university, but these policies and procedures are being shared with the presidents of other universities, and so that can be some consistency there related to masks and other parts of that response. At the national level, we're trying to share those policies and our thoughts with other leaders across the United States, with the American Council on Education under the leadership of Dr. Paul LeBlanc. Our chancellor sits on that executive committee and asked us to be part of that national conversation with other leaders and universities to think through, what is really feasible. A lot of the initial plans that came out weren't really feasible. You can't do the amount of testing or some of the other parts. And so we're trying to help that conversation so that people understand first why it is really, really important to get our students back on campus, the moral imperative that the chancellor just laid out related to the future of these individuals. But if we do that, what is the safe way to do it and what's reasonable, whether again, mask testing, what is that culture of respect for students and faculty on the universities to be able to do this in a reasonable way. And so again, from our university level to sharing with other national universities, trying to be part of that conversation to figure out what is the solution to be able to safely bring our students, our athletes, our faculty back onto our campuses. Thank you, Chancellor.
Thanks, David. So as David mentioned, I'm working every week with the American Council on Education. It's about 40 presidents across the country, and also working with McKinsey on a higher education post-COVID task force, which is very helpful to see what's going on around the country. Everybody is facing exactly the same kinds of challenges. And if you've looked at the Chronicle on higher education, you see that they've got about 700 institutions listed with their fall plans, and a full 2/3 of them are planning to reopen in person in the fall. Now, everybody from the people who most bullishly came out early on and said, we'll be back and we'll be in person, to the folks who said that we're probably going to be online. Everybody in that spectrum is putting health and safety first, and will make the decisions as we get closer to the dates that really matter. But for the time being, we think the best thing to do, and I think 2/3 of the institutions in the country think the best thing to do, is to plan for being in person and make any adjustments we need to make, which will include a good deal of education will be online, even if people are in person. We're not going to have large lecture halls with people sitting next to each other. And we're going to have faculty. I've talked to several who are very interested in being on a screen, even in a smaller classroom, because of vulnerability issues. Now, I just want a little housekeeping matter. We got a lot of questions earlier on through the COVID site, and we're through this agenda today going to work through, I think, a number of those questions. But I also want to make sure that the chat line is working, so that if you have a question, you can send it, and we'll take a look at it. The panelists will be able to see the questions. So I think we'll address many of them through the course of this discussion, but we certainly want to give you the opportunity to ask more. So just with regard to the kind of reopening question, which is a little bit of a misnomer, because we've had people in the building the whole time who needed to be there for their work, and we've had thousands of students on our academic campuses who had nowhere else to go, so we had dining and housing open for them. But obviously it's a question of reopening in a much more typical way. And we're fortunate that Dr. John Zerwas, the EVC for Health Affairs, has been one of the 4 members of the governor's strike force team, one of the health and medical advisors to that. So every day, in fact, I can tell he's sitting in the bunker underground in the State Command Center right now. This has been a great benefit to us, first of all, to be able to ask some of the questions to somebody who's sitting there every day with the people making the decisions, but also a great benefit that someone with his experience and his knowledge now of the university system is a part of that discussion. So I thought it might be helpful, John, if you just say a few words about the governor's plans and the state reopening, the kinds of considerations that you all are taking into account, which we will, of course, as well.
Well, thank you, Chancellor, and appreciate the opportunity to address the group. Certainly since mid-March, I have moved from the UT System building to the State Operations Center. So the idea of work from home doesn't have much meaning to me, but that's okay. I have enjoyed the opportunity to be here, and I am deeply appreciative of the governor's confidence to put me in this role. Several weeks ago, we actually did start to reopen. And one of the first things we did was to allow hospitals and healthcare institutions to start seeing patients again and start doing elective surgery and perhaps surgical procedures that had been delayed. And I'm very pleased that really most of the healthcare systems are probably 90–95% at their capacity right now. What they're seeing is now that they've kind of gone through some of the backlog of cases, they're seeing a little bit of hesitation for people to come out. There's still some worrisomeness out there with regard to COVID-19 and what impact it might have if somebody was going to have an elective procedure. So, but I'm very pleased that our healthcare enterprise really has really come back around and is really functioning quite well and on all cylinders, I would say. We have been very deliberative about the economy and opening up various places of business and so forth, doing that purposely. One is that we know Texas has done very well in flattening the curve, and that's a tribute to all the citizens of the state of Texas taking this whole epidemic very serious and doing the things that we know could mitigate, the healthcare system from being overwhelmed. And so people stayed at home, and people donned mask coverings, and people distanced 6 feet, and people became very compulsive about hand sanitation and stuff. Truly, the only things that we can really do to mitigate the effects of this virus. And so, as we have opened up, we have tried to make sure that we don't open up in a way that would overwhelm the healthcare system. But it also gives us a sense of, how embedded these habits are with people that are out there and stuff. And so, what we're seeing now, since really the 1st of May, when we started doing this, we've seen, outbursts of infection in nursing homes, meatpacking plants, our prison systems, any kind of a congregate type setting. We've seen, those places get kind of heated up, I would say, and we've tried to attack them with very much of a rapid response team concept to try to get control of those things. But if you look overall, the state of Texas, we've done very well at protecting our healthcare system. And the number that we follow every day is how many people are in the hospital based on a COVID-19 diagnosis. That has been very stable between 1,500 and 1,800 patients on any given day. And so what we want to do is to make sure that as we open these different businesses up, wait a week or two, let's see what the impact to the healthcare system is, whether we're seeing anything kind of ramp up and get out of control. And then let's take the next steps. So in mid-May, you saw the restaurants open up 50% instead of 25%. You've seen some of the water parks open up now. We've already set the stage for summer camps for youth to actually participate in, and as well as summer school for kids in our K through 12. So we are moving forward with the things that the strike force brings us, the 4 doctors that are the governor's physician counselors on this. And I would say that as long as people of Texas continue to keep these behaviors embraced, then I think we'll continue to do very well. And I would say similarly, Chancellor, as we come back into the building, to the extent that we all continue to exercise these good habits about masks when we can't separate by 6 feet, try to always respect the 6 foot distance between each other. Make sure we have hand sanitation, make sure that we're very cognizant of any kind of symptoms that might suggest that you could be a COVID-19 patient, fever, cough, fatigue. There's a whole list of things that people need to be tuned into as far as that might make them early on in the course of the disease there and stuff. So I'm pleased with where we are. I think that the March going through summer is going to continue to allow us to open up more businesses. And I think the next big place will be, in fact, the fall opening as to how we see things go as we bring students back onto campus. I'm very optimistic about it. I think we're in a place where we have to live with a certain amount of virus, but we also have to live with an economy and a higher education system and a healthcare system that's going to continue to thrive in this particular environment. So, thank you, Chancellor.
Thanks, John. The state of Texas is opening. Our campuses are opening. And I think it's important that as the administrative center leadership for the UT system, that we are engaged in the same kind of opening and physical presence. We've had a number of people write and ask when they could come back to the office, and if they'd be prevented from coming back, that they find it that they can do their work better in the building. And we've had others say that they are perfectly fine working remotely, that they don't want to rush this, and that they've had good success, or they may have other reasons why it's important for them to be working remotely. So like the state and like our institutions, we're going to think about this in a gradual way. And there are a lot of factors. John mentioned a number of them that, and I'm going to turn in a moment to Phil Dendy, who's been leading a task force on reopening the building considerations. But I want to say, initially, this will be slow. And on June 15th, the people you see on the screen and some of the other executive team will be in the office. And we will, in part, we want to be in this first group that is there. People are in the office. I can see David's in his office now, but people are in the office now. But we're going to have this soft initial reopening on the 15th of June. And at that point, we'll have in place the protocols that will be required, which will include temperature scans and a brief survey about symptoms. Nobody will be allowed in without a mask, without a temperature scan, and without responding to some critical survey questions. And then, as John mentioned, there'll be a number of requirements in place: how many people on an elevator, what the availability is of public space, that kind of thing. And we expect that it will be a relatively small number at first, but maybe somewhere up to 25%. But we're not going to pick an arbitrary figure, and we're going to have more conversations with managers and employees about that. And so anybody who has a concern about returning then, we will certainly accommodate that. But there are people who are looking forward to returning now, who believe that their work depends on them being able to return. And so part of what we'll be doing with this gradual return is allowing people who are ready to come back and can be safe there, but also keeping the numbers down so that they will be safer, and we can do the kinds of things we need to do with social distancing. So I want to turn to Phil now and talk about the work that's been going on over the last couple of months with this task force on the building.
Thank you, Chancellor, and good afternoon, everyone. And I'm actually in the office again today as well. Frankly, it feels pretty good to get out of the house and come in. I've been coming in a couple of days a week, so it feels good to be here. But as we've said all along, we're going to do this in a safe and strategic manner. We don't want to do anything that is outside of the bounds of what is reasonable. Clearly, we don't want to do that. Everything we've done so far is certainly in the parameters of what you've been seeing in other places and what our institutions are doing, as well as CDC guidelines and guidance from the state of Texas. I do want to say that a survey went out yesterday to get a sense of the numbers of people who are actually able to come back to work. I encourage you by all means to complete that if you haven't already. Please do that. It'll give us some good information that we need. Also, your HR business partners have been visiting with department heads to get a sense of the strategy by which departments need to repopulate the building. Chancellor mentioned we're going to be doing have masks. We're currently requiring masks in all common areas, lobbies, elevators, restrooms. That will continue. Once you're into your workstation, and if you can maintain social distancing, then you don't have to wear a mask once you're in, but if you can't, then it is required. As far as screening, we'll be doing that in the first floor lobby. We actually have a posting out there for nursing or other allied health students to be the screeners. There's going to be 3 quick questions. Basically, do you have symptoms? Have you been around anybody who's been diagnosed with COVID-19? Or have you traveled internationally in the last 14 days? 3 pretty quick questions, and then a temperature scan. You'll get a sticker for that day, and then you're free to enter the building. I would also encourage you to ask yourself those same questions before you ever leave your house that day, just to make sure you don't get all the way to the office and then have to turn around and go home. A lot of the concerns that we've had to do with our questions relate to disinfecting and cleaning. Prior to our shutdown, PBS, who's a contractor, a custodial contractor, maintained 4 full-time staff during the day, 12 in the evenings. They cut back a little bit on the evening staff when we went home, but increased the level of cleaning during the day. So beginning June 1, next week, they're going to have all of the NAT staff back, and we'll continue to increase the frequency of disinfecting and cleaning the building. On June the 13th, there's going to be a full building disinfection. That's scheduled and supported by regular and ongoing cleaning of building touch points, common areas, surfaces, elevators, meeting rooms, that type of thing. And they'll be cleaning those areas multiple times a day as well. There's been a lot of questions and concerns about air quality. Just want to address that quickly. Each floor is equipped with 2 air handlers, that supply that particular floor. And recirculation is per floor in our tower. There's 1 air handler located on each end for zoning. And there's UV light in those air handlers for disinfection of the airstream. So Stephen Harris and his team have been taking all precautions to make sure that is ongoing, and we've addressed that issue. In addition, in coordination with UT Austin Maintenance, there's going to be regular maintenance and filter service to further reduce any concerns related to that. Just a couple of other building-related issues. All meeting room occupancy levels will be reduced significantly to maintain social distancing. There's going to be signage on all those rooms so that you know what the maximum occupancy is. Schedules will be worked out with your supervisors and department heads so that no 2 people are in adjacent workstations at any particular time. Hand sanitizer will be readily available. There's new dispensers that will be installed and placed in all elevator lobbies and smaller dispensers all over the building. So they will be readily available. We're evaluating controls for the grab and go and the wellness center. There's going to be clear signage throughout the building for guidance and reminders of good practices. And we're working on a guidance document so that when we're about to re-enter, that there's a clear understanding and clear communication about all the things that we've done and all the things that really you need to do as we begin to repopulate. The bottom line is this is the first step of a very long journey. And we're working out in phase 1. It'll be a much smaller group of people coming in, but that's the time that we'll be testing and working out any of the kinks that that may have developed along the way. So with that, Chancellor, I think that's all I've got at this point, but
Okay, thanks a lot, Phil. So I just want to, there are a number of questions that have come in, one that I'm going to probably take later in the call, but one that I think is particularly pertinent right now, and that is temperature test. So I take my temperature at home, and what temperature raises a red flag? Any elevation?
We will be using 100.4 for entrance into this building. And so if you're above 100.4, you will not be allowed. And so I'd use the same criteria at home.
Thanks. So another question is about masks, and will there be a standard mask that the system will require? And so I'll say this, we are going to evaluate and provide masks for our employees, and they will be masks that we believe meet the requirements, and they may even be very attractive. We'll have to see about that. There's another question about this Austin school district and a modified schedule, and will the UT system be responsive to those with children in school? And I mean, the answer to that is yes, that we will, we're looking at all kinds of issues in this time of great disruption that would impact your ability to be in the building as opposed to working remotely, and including schedules, because we will, it is very likely that we will have staggered schedules in the building, so not everybody is coming and leaving at the same time. So I'm going to, well, I have another question that says, will employees be allowed to telecommute? And maybe we missed the first part of the call, but yes, we will, and my view is that there will probably be, as a result of what we've learned through this, a number, not an insignificant number, of people who will telecommute for most of their work. Won't be everybody. We don't know yet what that'll look like. If people have a reason to telecommute that's related to the disruption from COVID, whether it's health or childcare or vulnerable people in the household, or any one of a number of reasons, and they can do their job from home, then that will be a decision that's made between the employee and the manager. But we are certainly going to allow people to do that. I want to, we'll come back to any of these as questions come in, but I want to shift. We started with, the state and our institutions and their plans, then the building. And I'm sure there'll be more questions on the building, and you can certainly keep sending them the chat line now or the COVID website later, and we will make sure that HR responds to the questions about your work situation and the building. But the third big topic I want to cover is the budget set of issues. We mentioned earlier on what's happened in Texas with a tremendous change in the oil economy, which affects not only directly the 2 million acres of university lands and proceeds from that, but more significantly affects the overall economy of Texas, and will impact the state budget in addition to COVID. And so, there's been an enormous economic disruption in this country. 20% unemployment today nationwide, the most in 60, 70 years at least, 13% in Texas, which is an extraordinary record number. So there are a lot of our friends and neighbors who are without work now and will be in the future. That I think that most economists would say that this is in some ways not completely temporary. Some of these jobs will come back, and some of them are in industries where people have to work physically, whether it's hospitality or other service industries. But some of these jobs aren't going to come back. And I think we're going to see a disruption in the workforce that has been really predicted for some time in the analysis of what the future of work will look like. But I think it's just like online education. It has come now much more rapidly than we thought. So there'll be an impact across the university system, and already has been. Some of our campuses, over a month ago, I think UTMB they froze hiring, which has happened everywhere. We've frozen hiring, and our institutions have frozen hiring. We've all scaled back on purchases. We're pausing major projects. We've basically eliminated travel. UTMB furloughed employees, for all employees of UTMB, 1 day a week for 8 weeks because of their financial situation. They've had significant layoffs, as has the clinical partner of UT Health Science in Tyler. And we'll see more of this. There was enormous disruption at the academic institutions, particularly with their auxiliary enterprises, dining, housing, events, which didn't take place. And so the revenue to support the workforce related to those was non-existent. So we're going to continue to see our campuses make significant changes, and most of them have been preparing for this, as have we, for some time. It was not at all unexpected when the governor and the speaker and the lieutenant governor issued a directive that all institutions in the state, all state agencies, would submit plans on June 15th for a 5% reduction in the current biennium. So it is essentially a clawback of funds. And because it's 5% a year and the first year is almost over, it's essentially 10% in the little over a year that's remaining in the biennium. So that's a significant impact, and it has required each of our campuses to plan for that and for us to plan for it. And some of the things that we are doing, they're based on a set of principles about the basic mission of the university system, how important it is that we continue to operate and support our institutions that are doing great work. I want to keep the lean and very effective workforce that we have today in place. We want to take a number of steps that will allow us to preserve that workforce, and that includes the hiring freezes that we've done. It includes the fact that we will not be doing across the board salary increases. The reason for that is that we are trying to protect the employees and the core of the system at a time that is very challenging on the state's economy and on most institutions' fiscal situation. So the decisions that we're making will require some sacrifice, but we hope that we can keep our employee base in place and continue to have you do the good work that you're doing on behalf of the system and the state. We don't know what next biennium will look like at this point. I think I certainly expect that the fiscal condition of the state will not improve quickly. And at the time that we're preparing for the next biennial budget, I expect that we will be asked to submit reduced budget request at that time, not an increased one. We can hope for the best with the economy, but we've got to prepare for what might be the reality. So at this point, I'm going to ask Stacy Napier, the Vice Chancellor for Governmental Relations, to say a couple words about the process and what she thinks. And then I'm going to ask John Zerwas, who, in addition to being the health advisor, used to be chair of the House Appropriations Committee and may have some special insight into what will happen when the legislature is facing a difficult budget year.
Thank you, Chancellor. Just a couple of words to add on to what you said. I think you're correct that the oil and gas industry, as well as the compounded effects of COVID, certainly started back in March. We were getting word from the comptroller and others that they felt like it was prudent to start making some of those reductions now. I will add that the comptroller has said he's going to issue a revised budget estimate in July. That is not always done, but it definitely will give us a better sense of what the state economy is going to look like going into the next session. So, our campuses are all submitting to us their proposed, exceptional items for next session. I think we're all going to have to take a really close look at that and make some decisions about what our priorities are going to be from a budget perspective going into the next session. So that work will continue over the next couple of months. And I think come July, we'll have a better sense of that recovery and how long we may be in this state of recovery before we, head into session with maybe a little bit better picture of what FY22 and 23 look like. We know that the legislature has the rainy day fund. There will be less in that fund than there was, historically because of some of the performance of the oil and gas industry. But between that, the CARES Act, I think the legislature is going to basically kind of lay out all available revenue sources and have to make some difficult decisions going forward. So with that, I'll stop, and certainly maybe Dr. Zerwas has some additional perspective as well.
Thank you.
Thanks, Chancellor, and thanks, Stacy. Stacy's covered it really quite well. As a member of the Appropriations Committee for most of the terms that I served, which was 7 terms, and then serving as the chair the last 2 terms, I saw both ends of the spectrum. This last legislative session saw an enormous amount of projected cash revenue that the state of Texas had never seen before. And we were able to do some things that really were long overdue, especially in the area of public school investment and so forth. So, and those are ongoing costs that the state will incur, and is going to have to look at ways to do that. But in 2017, I was also chair of the committee where we realized we didn't have any additional revenue. In other words, we were just going to have to work off of the same amount of revenue that we'd had before, besides the fact that we had added a substantial number of people to the state of Texas, and there's some amount of inflation. And so, there are things that you do typically when you anticipate a fairly lean year. There's not a whole lot of areas that you can legitimately cut because so much of what we do has either it's something that's an entitlement and we're required to fund it, or it's something that comes with federal matching money, which you always try to not lose that. The thing with higher ed, though, is there's not a whole lot of that federal matching money out there. And so that's where I think it's very important for us all to, have those good, strong relationships with our legislators and, continue to help people understand how important and crucial, in fact, the mission of higher education is to the state of Texas, especially at a time where we are going to see a diminished oil and gas industry for a period of time, not indefinitely, but I think our U-shaped recovery might be a little bit wider than some other people's U-shaped recovery for that very reason, because I do think, as I think you do, Chancellor, the recovery of oil and gas might take a little bit longer just because of the nuances and complexities related to the whole oil and gas industry out there. But I think that the basic infrastructure of our economy is still there. You know, it was put you know, kind of in hibernation as a consequence of governmental action, and likewise governmental action can release that, and things can be allowed to wake up a bit, if you will. And I think we're seeing that. I think we're going to continue to see that. And I feel, you know, really quite optimistic. The legislature will take up its activity starting in January. Ultimately, the comptroller tells the legislature how much money they have to deal with, and then the legislature has to budget in accordance to that. And so there are lots of tools, lots of ways that we can look at trying to balance up that budget. Stacy mentioned the rainy day fund. Even in its diminished amount, it's an enormous amount of money, especially compared to other states out there. The question will be the will of the body in order to want to actually appropriate some of that money to help us get through part of this depressed period of time and stuff. So, you know, I think Texas will come back incredibly strong. It will take some time. But I don't think it's going to take you know, a period of time of years. It will take a period of time of months to get through this, to see the economy get revved up, to see sales tax revenue start to come back in, which is the biggest driver of our revenue to the state. And then with that, I think you know, as demand for oil and gas increases across not just across our country, but across the globe, we'll see, I think, a resurgence of the oil and gas industry, and that'll be a very powerful thing, not just to the University of Texas and Texas as a whole, but I think it'll be a very powerful thing to the country as a whole. So thank you, Chancellor.
Thanks, John. So just to bring this back to the more practical, the budget of the university. So the steps that we're looking at and the actions that we're going to take. I mean, it's no secret that we went through a downsizing within the last couple of years. So we're pretty lean now. What we're going to try to do is take those steps that try to protect jobs, try to protect the workforce, the UT system. We're at a point where we don't have a lot of excess capacity. So the kinds of things that the institutions are considering are the same things that we'll be looking at. And so I don't know, Scott, you want to say a word about the process that we're using?
Yeah, thanks, Chancellor. And again, I also want just to add my thoughts on context. It's going to be tough. I mean, we're going to be working with this for a while, both related to the pandemic, oil prices, the disruption the Chancellor talked about. But there are some reasons for optimism. You saw the financial markets, which have rebounded in May, recovering much of the losses that occurred in March and April. You know, I don't know how it will go moving forward. But the bottom line is we're still seeing some demand in some good areas, both at our institutions and nationally. And so we just need time to work through this. And so, for example, as the Chancellor indicated, we're working through a set of guiding principles. We're trying to save every dollar of cash we can this year. You know, we have cash because we haven't traveled, we've held positions, we've frozen positions, and we're setting aside those dollars to help us mitigate and work through whatever we're going to need to do in the next year and potentially the one after that. We are all in this together, and we're going to have to demonstrate, just as the campuses are, that we are good financial stewards and that we are understanding and reflective of what's happening across our system and nationally. You know, we can get through this. It will take some work. It will take some creativity. We're going to continue to look at, you know, are there contracts we can defer, not maybe forever, but even for 6 months or a year, you know, purchases that we were going to make. Can we continue to do what we're doing now, just given the unique circumstances? And then are there ways for unique opportunities for savings and revenue? The Chancellor mentioned, you know, I don't think we're close yet to being able to rent out or make available new space, but we are renting space that's available in our building already, and that's going well. You know, we're looking at, are there cost-saving mechanisms through some of the opportunities that we found, all, as the Chancellor indicated, ultimately to preserve sort of those core jobs. we are lean. We need that depth. We need to be able to secure and deliver services to our to the campuses and to our customers. And we're not planning to, go through just sort of an across the board kind of cut, but we're going to have to work closely to work through these things. But I'm actually, it's not going to be easy, but I'm actually fairly optimistic that we will have the time to work through this both this year and next year to get to a place where we can serve the clients and the customers in the state in the way that we should, and that we can protect the wonderful work that's being done already at the university.
Thanks, Scott. I think for now, that's really what we have to say about the budget from aside from the things I mentioned, the hiring freeze, not doing across the board salary increases, no travel, limiting purchases, and trying to do everything we can, as Scott said, to protect the funds and the cash that we have available so that we can meet the obligations that we have over a tough time. There's no sugarcoating this. This is a very difficult challenge globally and certainly nationally, and it is in Texas. The most important challenge is the health challenge. Right behind it is the economic challenge. And for those people that have lost their jobs, this is a compounded tragedy right now. So it's a very difficult time, but I come back to where I started, that the work that you all do and that the University of Texas system does is fundamentally important to this state. It may be the most important institution in this state. I would certainly argue that it is. And the fact that you have pivoted on a dime, continued to work, do your work in an exemplary way in circumstances that are incredibly challenging and different than they were before is heartening. And I'm very impressed. And I hope that we don't get to see each other very often. Actually, maybe the benefit or curse of Zoom is that you've probably seen, some of you have seen me more in the past 6 weeks than you would normally do. So, but we don't get a chance to get together and say, thank you for what you're doing, and you don't get to see your colleagues in the hallway. But I do, if I could leave you with a thought today, it would be one of the people on the screen, the Board of Regents, and I'll go so far as to say the people of Texas who saw how hundreds of thousands of students were educated and thousands of COVID patients treated in our health institutions and hundreds of thousands of telemedicine visits. I mean, the University of Texas system demonstrated its enormous value to the people of the state over the last 2 months. And for that, I'm deeply grateful for everything that you have done. And I look forward to seeing many of you, maybe not on June 15th, but at some point in the future in the building, and having a chance to thank you in person. But all of us deeply appreciate what you're doing. And if you have questions that were not answered today, please, we will collect those that we didn't get a chance to get to on the chat line and provide a response to those. But also we'll try to respond to all of the questions that come into the COVID website as well. So keep those questions coming. One of the things I think that we can do as a leadership team is to communicate with you as much as necessary, try not to overdo it, but to answer your questions because we want to remove as much of the additional anxiety out of this because of the unknowns. There are a lot of unknowns, but we can certainly tell you what we're thinking and how we're approaching this, and want to have your reactions, your questions, your input into that. So I thank you for joining us today, and look forward to the next time. Look forward to seeing you at some point when we're on the other side of this, and we can all get together. But in the meantime, thanks very much for all you do, and thanks to my colleagues for being a part of this today. Appreciate all you do for the University of Texas system. Thank you.